According to World Health Organization, over 2.3 million women were diagnosed with this illness in 2020 alone. It is the most common type of illness in the world. Do you know which illness I'm talking about? It's breast cancer. Breast cancer makes up 11.7% of all cancers diagnosed in women. It is the second leading cause of death in women after lung cancer, and 1 in 39 women will die of it. Yet, it is one of the most curable cancers. Good day, I'm Clarissa, and I'm going to discuss breast cancer, from its detection through its treatment and to its outcome. I will use the knowledge I have gained from relating to someone I know who has gone through breast cancer and survived. When breast cancer is detected in the initial stages, it will range from stage 0 to stage 4, where it has metastasized and to other organs in the body. Early detection is vital in the treatment and survival of breast cancer. As part of an early detection protocol, self-examinations once a month is vital. This, according to the US National Library of Medicine, should be carried out 3 to 5 days after the commencement of your menses and should be done monthly. If you don't know how to do this, you can go to your doctor or look at a good quality website that explains how to carry out self-examinations. In addition, you should visit a breast specialist for a yearly or bi-yearly mammogram and possibly ultrasound, depending on the density of your breast and recommendation by the consultant. You might be wondering, why see a breast specialist when I could just see my normal doctor? Well, the person I know thought the same. She would see her gynecologist for a mammogram bi-yearly, and one day they found a few cysts in her breast. The gynecologist then referred her to a general surgeon for a further investigation. The general surgeon then told her that there was nothing to worry about and come back in 6 months for a checkup. After 6 months, the general surgeon told her that she has nothing to worry about and that she can come back in 2 years. During those 2 years, she met a breast surgeon who told her about what a breast surgeon is and why you should go to them. So after 2 years, she felt the lump, labeled as a cyst by the general surgeon, was growing. This time, she decided to book an appointment with a breast surgeon. She had a mammogram and ultrasound to reveal that the cyst had grown and looked suspicious. This person then proceeded to show the doctor the previous scans and asked, "What would you have done if you had saw this lump 2 years ago?" The consultant answered that 2 years ago this lump should have been biopsied, as it already had signs of cancer, and that if the lump was taken out 2 years ago, that it would most likely have been pre-cancer and the treatment probably wouldn't need to be so life-changing. Later on that week, she was diagnosed with stage 2 aggressive breast cancer. Moving on to the treatment. Breast cancer can be treated in many different ways, depending on how the cancer presents. You can have a lumpectomy, which is where you cut out the lump from your breast as well as a margin of healthy tissue, or a mastectomy, which is where they cut out your whole breast that has the cancer in it. Depending on the aggressiveness of the cancer, you could also need chemotherapy, which is a combination of drugs that kills cancer cells, and radiation therapy, which uses high doses of radiation to kill cancer cells and shrink tumors. Although these things come with side effects, with a positive attitude, all of these can be overcome. The person I told you about had to undergo a mastectomy and 4 rounds of chemotherapy. She managed to overcome the side effects and pain with a positive mindset and her friends and family support. For most, the prognosis after treatment is very good, and they go on to live a long life. However, for many, they will have to take medication for between 18 months to 10 years after the completion of their treatment to reduce the risk of reoccurrence of breast cancer. For 5 years, you are considered to be in remission, but on that day, 5 years down the line, the patient is able to call themselves cancer-free. A day of joy and celebration. The war is won. Now, you may wonder why, as a 19-year-old, I'm passionate about breast cancer. Well, that person I used to highlight some areas of my speech was my mom. She developed breast cancer about 4.5 years ago and is now in remission, well on her way to being cancer-free. Her victory will be won by what my dad called Team Celine. It's made up of my dad, the project manager, her doctor, the nurses, the friends, and family. Breast cancer is scary, but it is treatable and curable. Early detection, the right doctors, and a positive attitude will give you the chance of winning that war. Anyone that said winning is not everything has never suffered from breast cancer. My name is Clarissa, and thank you for listening to my speech.